Okay. Hello, good evening, Super Tribers. How are you all today? This is Kausalya, your host for the session Incontinence. Just give me a few seconds to get things sorted from my end. So, can we just drop in a few highs and hellos so that I'll get to know that my voice and video is clear from your side as well? Just drop in a hi, Super Tribers. Hi. Hi. Okay. So here we go. Here we go. Hello. Hello, everyone. Hello, everyone. How are you today? Hello. Am I audible? Am I audible? So, are we? Hello. Okay. Nice to see you all here today evening. Good evening, everyone. This is Kausalya. You should know me from the tribe. So, today we are here to talk about the not so talked about topic, that is incontinence. So, just drop in a hi, hello. Is there just a little encouragement for us? Okay. We have our doctor and expert, Dr. Juhi from Ahmedabad, who is an MS in Obstetrics and Gynaecology. Good evening, Dr. Juhi.
Good evening, Kausalya.
So, this incontinence is a topic which is not so talked about even in this modern society. People shy away from talking about this topic. Uh, can we have a little insight on what incontinence is actually? Is it a disease or is it a condition?
Basically, incontinence of urine means there is an involuntary leakage of urine. So that is a person is unable to control holding the urine. Normal person will, whenever we have an urge to pass the urine, we hold urine sometimes when it is not socially acceptable. But in incontinence, there is a leakage of urine which is not controllable by the person herself. So this is basic. The basic definition is inability to hold the control holding of the urine. It is a disease because if not tended to at early stage, it can develop into a serious condition and later on can cause an impact in the life of a woman.
Okay. What could be the causes of this incontinence in pregnancy time, doctor?
So basically the main cause of incontinence is there is a loss or decrease in strength of the muscles which support the urinary bladder. That is the organ which stores the urine, and from the urinary bladder there is a urethra coming out which will cause the urine to pass out in the outside. So there are various causes in different stages of life. In pregnancy, due to increase in weight of the person, due to the increase in weight of the fetus, the developing baby, there would be decrease in strength of the muscle due to the weight. There is an increase in weight which presses the muscles and causes it to decrease the strength. So at that time, the person may have an involuntary leakage of urine, but it doesn't happen any time. It happens whenever the person sneezes or coughs or laughs loudly. So whenever there is increase in pressure in the abdomen, it causes leakage in pregnancy. This also happens postpartum. This is called as stress urinary incontinence. That's temporary. The person doesn't have leakage every time, but only when there is an increase in the pressure in abdomen in these conditions. And after the childbirth, after difficult delivery or like forceps delivery or vacuum delivery or an obstructed delivery, the muscles lose their strength. The pelvic floor muscles lose their strength, and that is why this condition develops post childbirth and during pregnancy, as I told before, due to the increase in the pressure over the muscles, which causes the decrease in strength of the muscles. So during pregnancy and after childbirth, the most common type of incontinence which we see is stress urinary incontinence. The other common type of incontinence is urge incontinence. In urge incontinence means the person is not able to control the urine whenever there is an urge for urination. So as I mentioned earlier also that if in normal persons whenever they have a desire to urinate, once we find a washroom or once we find that it's socially acceptable to pass urine, then only we go. Otherwise we can hold the urine normally, but persons with urge incontinence, they won't be able to do so. So they have to rush as soon as they have a desire to urinate, and in the process of rushing they might have a leakage of 1 to 2 drops, and that becomes embarrassing, that becomes quite unacceptable to the people, and in a long term the people they may fall into depression or they have anxiety because they are not able to discuss this thing freely with their family members, with their friends, and they don't go to doctors because of this condition.
Doctor, in case of pregnancy, you say that the uterus has to bear the weight of the baby, so that is why it is going to cause pressure over the bladder, and incontinence is going to come. So, what about
Yes.
the postpartum? Like you say, won't the uterus get try to get back to its original size? So, even then, how long can we expect this incontinence to happen postpartum?
So postpartum, the uterus goes to its normal size by 1.5 months. That is 6 weeks postpartum. Till then, the patient might suffer from incontinence because of the weight cause. But the other reason for incontinence is childbirth. Childbirth itself, that is normal delivery. No, I'm not talking about C sections. The normal vaginal delivery. There is a stretching of the pelvic floor muscles to allow the baby to pass through the vagina. So this muscles and the ligaments will be getting relaxed and stretched, and they take time to come back to the normal position, especially whenever there is traumatic delivery or forceps delivery or obstructed delivery. The ligaments and muscles are stretched more and more. Even in persons with multiple deliveries, those who are having 3 or more vaginal births, in those cases also the ligaments have become lax. So in those patients, sometimes the muscles might not go back to the normal stage as it was there before. So by doing some kind of pelvic floor exercises like Kegels exercises, this can be prevented, and the tone of the muscle can be regained later on.
What are the consequences apart from being embarrassed, or will this have any long term issues on a woman's health?
Like basically there are long term issues like a person, suppose if we imagine that a person is not able to hold urine, if she passes urine and if she's having her panties wet whenever every 2 to 3 hourly, she is embarrassed, she won't be able to know what is happening to her. Other than that, due to the wetness, there is increased incidence of urinary tract infections. There are increased incidence of rashes because of the wetness. So that thing may lead to other conditions, more serious conditions.
Okay. Main thing is like women do not talk about it. How much do you insist on women talk about such conditions, come out openly, talk to her doctor, or talk to a friend, a mother, or whomsoever is close to her? What is the importance that why she should be talking about this?
So
How
even a
much will you
slightest
your
amount of Yes, so even a
sorry.
slightest amount of incontinence, if a person is having even a mild amount, even if she is having incontinence of 1 or 2 drops while laughing or anytime, she should seek help, because if not taken care of at an earlier stage, this might develop into a major incontinence later on, and some mild forms of incontinence which can be cured by conservative methods, that might not be cured when it is in later stage. So she might need a surgery, or sometimes even surgery can't help. Then they have to live with it their whole life. So it's better if they come out and they seek help when it's in a mild stage.
Okay. Doctor, now suppose a woman needs to, can she do a self examination on herself and decide that she has this condition, or is it a must that she should always go to doctor first? I know we should always go to doctor's
Yes.
advice on this, any medical condition for that matter. But is there any possibility that she can self examine herself and decide that she has this? So she
See,
will also be clear from her side.
See, any woman has these symptoms which I mentioned before, like they have urge to urinate and they cannot hold it, or they have involuntary leakage while laughing, sneezing, coughing, or while lifting heavy objects. Any amount of leakage of urine, then they should definitely seek doctor's help, because self-examination won't be possible. We need to have a detailed evaluation.
Okay. What about elderly women? Women above 40, 50 plus, will they also have this condition? Is this age related also?
Yes, this is definitely age related. While around 30% of incontinence occurs in pregnancy and after childbirth, the rest of the incontinence which we find are in elderly women above 40, or those who are into menopause. So as we age, as the menopause sets in, there is a decrease in levels of hormones, especially estrogen hormone. And because of the decrease in hormone, the ligaments as well as the muscles lose their strength. The protein in them is lost. So as I mean, they lose their ability to hold the organs in their place. So this will cause involuntary leakage. Basically, the urethra, that is the opening which connects the urinary bladder into the outside, it is supported by a muscle on its surrounding, and it will contract whenever we want to hold the urine. So the ability of that muscle to contract will be decreased as a woman ages, because of lack of estrogen. And after
Okay.
menopause, there is quite decrease in the strength.
Okay. So hormones also do play a role in this. Is
Yes,
that what
definitely.
you're telling? Okay. Is this condition only related to women, or do men also have these conditions?
Yes, men also have this condition in cases like there is enlarged prostate, or whenever there is UTI, there is urinary tract infection, or any obstruction like urinary stone. That is in both women as well as men. Or any neurological condition like there is a spinal cord injury, or Parkinson's disease, or diabetes, chronic diabetes in both males as well as females. The urinary bladder will lose its innervation. The nerves which help us that now it's time to urinate, now it's time to hold the urine, those would be degenerated, and that will cause incontinence. So yes, both males as well as females are affected, but women are affected more than men.
Okay, so you say like there is a higher chance of women, both elderly, even pregnant and postpartum women, to have this condition.
Yes,
Okay,
definitely.
doctor, is there any specific investigation that we need to undergo to like to know about this condition that we have?
Right. So the first thing first, whenever a patient comes with a complaint of incontinence, first of all we do a examination to ensure and to know which type of incontinence she is having, whether it's an urge incontinence or it's her stress incontinence. So while asking a patient to cough, we observe that how much amount of urine and when the urine is coming. The other test which we which the patients undergo is urine analysis. That is analysis of urine, that is urine examination, to know whether any infection is there in the urine, because transiently whenever there is urinary tract infection, transient incontinence occurs, which when the infection is cured, the incontinence goes away. So the next step we do is urine analysis, and if urine infection is found, we treat it, then the incontinence goes away. The third step would be urodynamic studies. In those investigation, we insert machines and electrodes at various places, and we examine the flow of urine. We examine if there is any residual urine left by doing an ultrasound. After the person has passed urine, we examine if there is any urine left inside, and what is the force of the urine coming out, and is there any force while the person coughs or not. So that is called as urodynamic studies. It's a vast amount of tests.
Okay. So, how common is this incontinence related to urinary incontinence is related to the infection, UTI infection, doctor?
Around 30 to 40% of the patients with urinary tract infection might present with incontinence.
Okay, but all these, the ones which are related to urinary tract infection are completely curable. Curable, like once the infection goes off, the incontinence also reduces, the condition
Yes,
reduces, right?
unless it is associated with any other factor. If all the other factors are not there, then yes, it's completely curable.
Okay. What could be the treatment options for these condition, doctor?
Okay, so
What are the treatment
before
options?
yes, before we go to the treatment options, I would like to all the people here to know the prevention method, because prevention is better than cure, right? So
Very true.
all the females, whether they are pregnant or not, whether they are having incontinence or not, should do Kegels exercises. The Kegels exercises are the way to prevent incontinence from happening. So I'll like to, I like to know if anybody knows about Kegels exercises. If anybody knows, they can comment. And Kegels exercises should be done by all females above 30 years of age during pregnancy, after childbirth, and in menopause also. So Kaushalya, anyone is does anybody know?
Hello?
Hello. Yes.
Yes. Doctor, am I
Okay.
audible?
Yes. Yes. Am I audible?
Okay.
Okay.
Yes, yes.
So
There was
yes.
some interruption with my network, I feel. I'm sorry on that.
Okay, okay. So I was talking about Kegels exercises. The Kegels exercises should be done by all the females, and it will just take 5 minutes of your time. You have to identify your pelvic floor muscles first. You have to know, just imagine yourself that you are urinating in the washroom, and you are interrupted by someone. Someone is knocking the door and they want to come inside, and you are interrupting your urine. So how will you hold the urine so that you can get up? So that act is contracting the pelvic floor muscles, contracting the muscles which guard your urethra. So that contraction you have to make. You have to first of all empty your bladder. First of all, you have to go to the washroom. Then you can either sit, either stand, either do this exercise while cooking, any time. You have to hold like that, as I mentioned before, and count till three. One, two, and three, and then relax again. Then again you have to hold, count till three, and then again relax. Initially you have to count till three and do three repetitions of this, and then as you are able to you have to increase the number of the seconds of holding you, and increase the number of repetitions. The goal is to do 10 repetitions like this for 10 seconds. So like hold the urine, count till 10, relax, again hold, count till 10, relax, do 10 repetitions, and do three such series in a day. So total 30 repetitions in the during the day, 10 in the morning, 10 in the afternoon, and 10 in the night. You don't even nobody has to know that you are doing exercise. You can do this while cooking, you can do this while watching TV, you can do this while playing with your kids. Nobody knows, nobody other than you will be able to know that you are doing this exercise. But doing this simple exercise will help in prevention of incontinence at a later stage. So whether you are pregnant, whether you are newly married, or whether you are into menopause, please do these exercises. Because once incontinence has developed, it develop, once a severe incontinence is developed, this exercise would not be of any help. So this is the first step of prevention. Now as we go into the treatment options, first we treat the cause. So if any cause is there, like urinary tract infection, or neurological cause like diabetes, then we treat that infection. Sometimes kidney stones which have dislodged and come into the ureter inside, the stone will cause obstruction and cause incontinence. So if the stone is the cause, then we do something about, either by surgical method or a medical method. We remove the stone and then see if the incontinence is still there or not. So first is the treatment of the cause. Then the other options are some medications. There are different types of medications available according to the patient's condition and the patient's stage of incontinence. We give the medication and see if she is relieved by that or not. Some behavioral methods are also there, like bladder training, maintaining a bladder diary. So this will help in over this urge incontinence, and the patient will be able to hold the urine for a longer time. And at last, there is surgery. The surgery to increase the tone of the pelvic floor muscles, to support the pelvic floor muscles. The surgery is done, and this will support the urethra, and it will help in decreasing the incontinence.
Doctor, from which month, like a pregnant woman, from which month can she start doing the Kegels exercise?
From the very first day.
So starting from a first trimester, she can start the Kegels
Yes,
exercise.
yes, yes.
Okay. Even the elderly women who is like above 50 or something, they can also do this Kegels exercise.
Yes, yes. Any person about 20, about 30 years of age can do this exercise regardless of pregnancy or not.
Okay. Doctor, we have at SuperBottoms, we have incontinence underwear. So you must have heard about it. So is incontinence underwear, does it help a person who has this condition a little? How does this
Yes,
help actually?
yes, absolutely. Those patients who have chronic incontinence, or they're awaiting surgery, or they are on any medical therapy for incontinence, they until the treatment works, she will be facing she will be wetting her panty every now and then. So getting the panty getting wet, and she has they have to change it every now and then, and if not change at a regular time, she may develop urinary tract infection as well as rashes. So this incontinence underwear, it will help a lot in these patients, because whatever leakage is there, it will be absorbed by the underwear, and the upper layer would become dry. So just like in periods, or like in our baby's diapers, they become dry once all the urine is absorbed inside. This also works in that way. So the person feels dry all the time. She doesn't have to change the underwear every now and then. And this underwear is just like a regular underwear, so you will not know that you are wearing any special underwear. It can be worn under any clothes. So the daily routine becomes very good for this person, and it's actually a boon for incontinence patients.
If at all a person has this condition and he or she comes to a medical treatment, how long will it take for them to get back to normalcy, doctor?
Well, it depends on the cause. It depends on the level of the incontinence. Most of the persons can they get treated by continuous therapy of 6 months or 8 months. But suppose don't get they don't get recovered by this, then surgery is an option. With surgery, around 80 to 90% of the patients get immediate relief.
Okay. Doctor, we have questions from some of our viewers. Let me
Yes.
just read it to you. Is this somewhere related to kidney problems?
Kidney problems like urinary tract infection as well as kidney stones, anything which obstructs the outflow of urine will cause the bladder to be full, and once it is full the bladder overflows and then it causes incontinence. So yes, not exactly kidney problem, but the subtypes of kidney problem like stone as well as infection, it may cause incontinence. This is mainly due to the urinary tract is made up of two parts: the upper urinary tract and lower urinary tract. The upper part is the kidney and the upper urethra, and the lower part is the lower ureter, bladder, and the urethra. So incontinence mainly deals with the lower urinary tract.
Okay. One more question from Priyanka Vijayan. My mom complains about incontinence after DNC, which she had to undergo during the menopause stage. And after exercise, it has reduced. So, can it be continued as a regular practice?
Yes, she can continue the exercises along with guidance from her doctor, and she needs to see which type of incontinence she falls into, and what is the grade of the incontinence. Yes, if exercise helps her, then she can continue the exercises lifelong.
Okay. We have a question from Parveen. Can Kegel's exercise be followed during periods too?
Yes, Kegels exercise
So,
can be
Parveen,
done at any stage of life.
okay, so Parveen, I think you have your answer. You can start your Kegels whenever you want, even in your
You
periods.
can
So
even do
periods is
Kegels
not going to
right
stop
now.
you.
You can even do Kegels right now
Yes,
while watching this live.
yes, I have started doing when you started explaining about it. I just did try, but will it take some time for us to count to 10 because I was able to do only till 4.
Yes, initially you have to do till 3 only and increase it by day. So
Okay.
our goal is to hold it till 10, but you won't be able to do it right away. So start from 3 and then gradually increase it to 10.
Okay, so from 3 to 10, do we have to practice it like twice a week, thrice a week, or it can be a daily routine? It can be a daily part of our life?
It can be a daily part of your life. You have to do it every day, 3 times a day. So if you are counting till 3 and then releasing it, then do it 10 times at a stretch, 3 3 seconds. Then in the morning, in the afternoon, then in the night. So once you are able to do it properly, try to increase it from 3 to 4. So if 1 week you are able to do three repetitions every time, then increase it to 4. Then next week increase it to 5. So by the end of the month you will be able to increase it from 3 to 6. Then next month you will be able to do it till 10.
Okay. Doctor, is there any early stage treatment apart from this Kegel's exercise, preventive measures like using incontinence underwear? Is there any specific medication that you can, like, we can start taking with doctor's advice, which will reduce the condition?
See, all the medications which are available for treatment of incontinence are to be taken in a very supervised manner. Otherwise, they will have side effects. So it's better that even if it's an initial condition, better to see a doctor, and because there are 10 to 12 types of medications available for incontinence. So the patient falls in which category, that would be decided by the doctor, because some medication should be avoided in hypertension, some should be avoided in diabetes, some should be avoided during pregnancy. So in which category the patient falls, that the doctor has to decide, and then the medication is to be taken. And other than that, the preventive measures, as I told, that apart from Kegels exercise, certain lifestyle changes have to be done. Like if you are obese, if you are overweight, then you are at an high chances you have that you will be having incontinence. So maintaining an optimal weight will help to reduce incontinence in future life. Smoking, alcohol, and caffeine, these three things, they also have a positive impact on incontinence. So if you are doing it in excess, actually smoking you should stop immediately, and otherwise alcohol and caffeine you should be taking it in limits, so that you don't have incontinence.
Okay. So, tribals, I guess you must have heard all this. There is no over the counter drugs for incontinence. So,
Yes.
in case of doubt or in case of any doubts or hesitations you have, please do talk to your doctor. Doctor, I just want to have a personal question with you. Um, After I delivered my baby, for 2 to 3 months, I did have incontinence. That was when I sneezed or when I had to get up suddenly, something like that. But over a period, it was not there. I found like I did not have any urine leaks. But off late, probably in the past 6 months or something, I can feel when I try to lift some heavy objects. Is this normal? Like, does it go away and again come back?
No, you should do exercises regularly, and you should probably get yourself examined, because if it's transient, like you said, that after childbirth it has been reduced, but again if it's happening, because right now you are not pregnant or you're not delivered recently, so you might be having any pathology, so it's better you get yourself checked. But it's not normal, like incontinence, it's not normal. You should not underestimate it. You should get it checked, and you should start the treatment as soon as possible. In some
So
cases, yes,
tribal.
in mild cases of stress, as I said, two types of incontinence are there. So stress incontinence might be transient. So in cases of urinary tract infection or stone, or briefly after during pregnancy and childbirth, it goes away. But if done with exercises, you will be better soon.
Okay. So, tribals, you must have heard the wonderful advice and medical advices that Dr. Juhi was giving us. So, this was such an insightful session, and thank you, Dr. Juhi, for giving us your time and your valuable medical advice to all the tribals here. This must have helped them a lot. Your thoughts about our tribals, Dr. Juhi?
It's my pleasure to be here with SuperBottoms. I have personally tried the this incontinence underwear, but as a period underwear, and I found it absolutely great. And by the way, I am a 100% SuperBottoms mom. My son has been using the SuperBottoms for first dry fill langot, and then Uno, and then padded unders, and now underwears. We are now potty trained, but I still miss SuperBottoms in as a part of my child's life, and it's my pleasure to be here as a guest speaker.
Thank you so much, Dr. Juhi. This gives us immense pleasure to know that you are also a Super Bottoms mom. Uh, this is really nice to meet another Super Bottoms mom live.
Yes,
This is really, really
likewise.
nice. Okay,
Yeah.
thank you for answering our viewers' queries so patiently with such good, insightful thoughts on the condition. Viewers, I think you must have got your insightful news or insightful points from Dr. Juhi. So stay tuned with us. Stay tuned to the Parent Tribe for such amazing sessions and also some good contests and giveaways. Thank you so much. See you in another live. Bye bye.
Thank you, Kaushala. Bye.
Thank you.